more than just anecdotal evidence because we need biopsy. But you gotta first of all see what you've got there.
Understood. What about some of these synthetics? You know, there's a bunch of synthetic THCs and CBD. You know.
No, those aren't the synthetic THC. The only one around is dronabinol.
No, but I'm talking that there's like some other like
things like Sesamet and so forth. Yeah, they're you know, there's no doubt about it. You can take the 21 carbon molecule, which is tetrahydrocannabinol, and you can make modifications of it like you can in any. And there are more than 80 cannabinoids. The two most important from the point of view of medicine are tetrahydrocannabinol and cannabidiol, CBD. Now, it's also becoming clear that the terpenes, another thing that is found in the cannabis plant, may also have importance. For example, it now seems clear that dronabinol doesn't work nearly as well as whole marijuana, whether ingested or smoked. And one of the reasons that's thought to be is because it's not just THC, but it's the ensemble or entourage effect. That it has to be accompanied by some of these other molecules or behave synergistically with them, but it isn't just a synthetic molecule.
Let me ask you this: the quick rise of THC into the system when someone is smoking, and the rise and the quick drop, where it goes, whatever the high peak level is when someone stops smoking.
Yeah, it goes into the fat.
Goes into the fat, but in a very short period of time. And I've had this because of the issues of levels of THC in someone's blood when they're behind
some of these attempt to control the problem of driving with THC. Well, let's take as a standard, and the one that has been accepted in one of these things, which to me seems foolish, 5 nanograms THC per milliliter, and if you've got above that, you're going to be charged with DUI, and if below it's well, that doesn't make any sense because, somebody who gets high for the first time will have a level of about 5 nanograms or higher, and but somebody who uses it regularly will have lower than that, and even somebody who uses it regularly and uses a lot, enough of it is being secreted from the fat where it's stored and gradually secreted that you can get above 5 and you're not the least bit stoned. So it's not like alcohol where above a certain level there's no question, although there's generally no question that this person's function is incompatible with driving a car or doing much of anything that involves the cerebral cortex. But you can't set there is no single set point here because it's crucially dependent on how long ago you smoked it, and you can't, and what's been your experience before it and so forth. You can't have, it isn't a simple solution, 5 nanograms per milliliter it just won't work. And also, you can't just have a police officer, put a needle in a suspect's arm to take the blood you need to do this. So I think that's barking up the wrong tree, frankly.
I agree with you, and we have an issue with that in Michigan. There's a laws which is any presence of a controlled substance. But I had a trial about this. Someone had 6 nanograms of THC, same issues, arguing about their metabolism. It's stored in the fats and whatnot. But one of the things that kind of came to mind, is the idea that the highest point of THC that's in a person's bloodstream, like when they take that last puff on the joint, at that point in time, it does not stay at that level for very long, and there's a dramatic decrease. Like whatever the number, if it's 100 THC, it usually levels down, and within a very short period of time, maybe 15 minutes even, the THC levels are like 12, 10, 8, 6, and these are the common. Usually when people are taken from the car after smoking, by the time they get into the hospital with a search warrant or consent when they draw blood, some period of time has passed. But most of these numbers are there. And, as I was talking with this expert, he's a toxicologist, not a, in pharmacology. We were thinking about, like, is there the delivery system of that rise and fall? Does that have something to do with getting it into the bloodstream? We talked about that kind of combination effect, or the whatever you called it, like the. Do you think that there's something to that? Whereas like.
Well, it is. I mean, for example, if you smoke it, you see, or inhale or vaporize. When I say smoke it, I mean use vaporizer. Take it through your lungs. See, what happens is, you take it into your lungs. It goes from your lungs directly to the right side of your heart, then to the left side of your heart, and then right up to your brain. So you get an effect pretty quickly. If you take it orally, it has to go through the digestive tract, and approximately 12% of it is absorbed, but it depends on when did you last eat and a lot of other variables, and it certainly varies from person to person. And then it goes into the liver on the way to the heart. And it's changed slightly. The molecule, the THC molecule, is carboxylated. And in that case, it takes a while for the high to come on. Let's say between an hour and a half and 2 hours. And the blood level goes up very slowly and comes down relatively slowly. So there are great differences there. But I think the major point to keep in mind is the blood level in nanograms is not going to have a direct relationship to the degree of psychoactive high, or whatever you want to call it. It doesn't follow exactly. It isn't like alcohol, where you can be pretty sure if somebody's got a blood level, he's really drunk. There's no question about it. You can see his behavior. So it's a much more difficult thing.
I was going to say the case. It was interesting, and I remember the exchange between the prosecutor and my expert, where she was asking him, "Well, at 6 nanograms, isn't that affecting him?" And he said, "Sure, it is. It's affecting his pain. It's affecting his appetite. It's affecting his." Oh, you mean but it's affecting. She wanted to hear psychotropic effect, and he was talking medicinal effect. I mean, it was just a really, because 5 nanograms is not right. There's no psychotropic effect. And what I thought was that, if someone is medicating around the clock or throughout the day, they're always going to be at that level. Always. Something in their system. It takes to get to zero. You know what I mean? So to penalize someone, is going to have some active THC, most likely, if they are.
It doesn't. It may not have. For example, now with this cannabidiol, which has little. In fact, it has an anti-high aspect to it. You take cannabidiol, and then if you try to get high, you can't. But it has all these medical, or most of them that we know of, utilities. And, that's a boon for, Stephen Jay Gould. Do you know that name? The Harvard paleontologist who wrote so many interesting books. Well, he had testicular cancer. He's one of the patients I described in my book. He had testicular cancer, which had spread and was threatening his life, and he had to start chemotherapy. And he got to a chemotherapy which caused such vomiting, nausea you could feel in your toenails. And he said he felt he couldn't go on with the treatment. It just couldn't do it. And when he did continue, and he was a person who was with the chemotherapy and the radiation, he was cured of his testicular cancer. But wouldn't it have been great if he had lived in the day which we are now beginning to see, with a high cannabidiol content, he wouldn't have had any of the high. He would have the same anti-nausea, anti-vomiting effect, but no high. And this is one of the exciting developments in the development of this plant as a medicine.
Does Marinol show up in someone's blood as THC? You know?
Yeah, Marinol is THC. You see, Marinol is just the same 21 carbon molecule as the thing we call THC, only the hypocrisy of the government is demonstrated because they said, yeah, but we're going to take that one out of Schedule 1. It's part, it's part of, excuse me, it's part, it's one of the things in the marijuana which is in Schedule 1. It cannot be used for anything, even research. But they moved it to Schedule 2 so doctors could prescribe it, and then later in '92 they moved it to Schedule 3, so it's even. But it's the same thing that you get from the leaves, from the bud.
Right.
It's not different.
Right. You listen to Planet Green Trees. Call numbers 1-347-326-9626. I'm your host, Michael Komorn. We are on with Dr. Lester Grinspoon. Just a fascinating conversation. We're going to go on a little bit longer than we normally do, if that's okay with you, Doctor. If we've worn you out or you're getting sick of me, just let me know.
Go right ahead.
Okay. I know some other people here in the studio may have a couple questions. I know you would talk to Theo, who is very, very helpful at getting in touch with you. Anyone want to jump in here? Chad?
I've noticed there's a lot of variability in uptake as far as feeling the effects when you're ingesting gastrointestinally. And it seems to me that some of that is a difference between whether or not the ingested product is decarboxylated or not. Have you any experience with that at all?
No, I don't understand why decarboxylation, something happens in the liver. And I don't understand why someone would take or where one would get decarboxylated drugs to take.
Usually we do it by heat. We are decarboxylating.
Yeah. You heat in oil or something like that.
Correct.
Well, as far as I know, that doesn't make much. As far as I know, that doesn't make much difference. I don't know really the answer to that.
Aquarium drinker, assassin down the avenue.